Sit comfortably on the floor to set a baseline forward bend. Bend the right knee. Externally rotate the leg and place the sole of the foot in a comfortable position somewhere on the left inner leg, on the thigh or the calf. Support the knee if it doesn't reach the ground easily. Activate the left leg by pointing the toes upward and activating the foot triangle. Place the palms together at the chest. On an exhalation, bend forward from the hips with a straight spine, moving to your comfortable range of motion. Notice any sensations. Then change legs to repeat the baseline on the other side. Again, noticing any sensations as you move into the posture. Place the sensi ball on the folded towel, then position the ball and towel under your left knee. Bend your right knee with the foot standing on the floor. If necessary, use props to find a comfortable seated position. A cushion or folded blanket under your pelvis, or a wall to support your spine from behind. Balance on your sitting bones to maintain upright posture. Your hands can clasp the bent knee or be placed on the floor behind you, and you can change your arm position any time you want during the practice. For a few moments, become aware of the sensations in your posterior knee where it rests on the ball. On inhalations, imagine directing your breath there. On exhalations, visualize your knee softening and draping over the ball. You can reap much benefit by simply resting your knee passively on the ball. Be attentive to subtle shifts and releases in your knee. Notice your breath as you rest in listening mode. Begin with knee extension. On an exhalation, slowly and gently press the back of your knee into the ball, compressing it slightly. On the inhalation, gently release the pressure. Notice the sensations of the quadriceps engaging. You can use your hand to feel the activation. Sustain dynamic engagement of the 3 foot triangle points throughout this practice so that the toes remain pointing upward. Each movement in the practice can be done about 8 to 10 times. Now engage your quadriceps in a different way. On exhalations, slowly and gently slide your right heel away from you so the posterior knee passively presses into the ball. Gradually relax your leg on inhalations. Again, you can feel the quadriceps engaging. following the sensations. Move now to hip joint distraction and compression. On exhalations, slowly plant or flex your ankle, pointing the toes away from you. On the inhalation, dorsiflex your ankle, moving the toes towards your torso. Back and forth. Notice how the sitting bone moves also back and forth as your ankle flexes and extends. Now, imagine a line between your sitting bone and heel that extends beyond your body in both directions. On inhalations, slide your sitting bone forward along the line so the leg moves away from your torso. On exhalations, slide the sitting bone backward along the line. Move the whole leg as one unit. And keep your foot triangle activated. Notice how this movement shifts the position of the hip socket and massages behind the knee. Now explore internal and external rotation. On exhalations, slowly externally rotate your leg so your toes move laterally. On inhalations, internally rotate your leg so your toes point toward the midline. Notice how the movements roll the ball of the femur in the hip socket and massage the posterior knee. Finally, combine all these movements into circling. Circle the foot slowly and gently in both directions, reaching out through the heel and maximizing movement through the ankle. Go both directions. Imagine the gliding movement between the tarsal bones. Then repeat the baseline forward bend on both sides. First with the right leg bent, noticing what's different, and then with the left leg. Notice what's changed since your original baseline. Then straighten both legs. And notice how the sensation differs between them. Before you repeat the movements on the other side, stand and walk around, noticing how your felt sense of your leg has changed.